Hello, this is Arlo Kilpatrick, the erudite Tinophile. Uh, I wanted to make a video here for two reasons. First of all, I'm not in my usual place. I'm in the house where I first learned that I was a zoophile. Well, technically I'm not in the house, but I'm in the town. So, I thought it would be appropriate to make a more personal video here, but I'll do that later. Secondly, I've gotten a new job. I start Monday. And unlike my previous job, which was grunt work, this job will allow me to use my education to the fullest. Also, nice little bonus for me, two very nice looking wine runners are there. Uh, Not that I'll do anything with them, of course. It's like sex with a coworker, except, of course, that they don't do any actual work. But, it's nice that the place is at least animal friendly. So anyway, I wanted to make a video about uh, disease risks in zoophilia. Well, disease and injury risks. Because it seems to me like this is something that would come up in a reasonable argument about this topic. I mean, people are used to seeing sex as a medically risky activity in terms of disease, and as a result, they tend to view sex with animals, since it's so rare, as even more risky. However, I would disagree with this. Now, of course, there isn't that much data on it because uh, zoophiles are naturally reclusive and aren't going to report disease quite as often as it happens. But there is a little bit of data about what diseases can theoretically be transmitted to human beings or from animals to human beings and vice versa. If you go on Wikipedia, Wikipedia is a great resource for impartial information on zoophilia. Although, admittedly, there are better resources out there in terms of sociological studies. For the more practical stuff, the legal implications and the disease risks, Wikipedia is actually pretty good. And they link to other sources which are even better for their particular diseases. So, good for them. Alright, so I'm going to go through the list very briefly and try to argue why particular diseases are less risky than uh, human sexual contact. So, starting out with brucellosis. Brucellosis is actually a really nasty disease. It affects the liver, it affects the heart, it affects the lungs. It's just really nasty. Fortunately, it's also quite rare, especially in North America. It may be present a lot in developing countries like in Africa and parts of China, but in terms of its presence here in the United States, it's pretty rare. There are about 100 cases a year that are reported, although it's probably underreported since it's so difficult to diagnose. Even if it is underreported, it still pales in comparison to the numbers on human sexually transmitted diseases, as I'll talk about in a moment. Let's see, what else is there? Leptospirosis. Again, this disease is really nasty, but also really rare. The rates are something like 0.02 out of 100,000. And you see these rates out of 100,000 all the time because these diseases, each individual disease is rare enough that you can't really say like X percent of people are going to get it because it's just too small a percentage. Q fever is pretty nasty, but also somewhat rare and treatable. And those three are the only ones which can be transmitted through semen and vaginal fluids. Brucellosis, leptospirosis, and Q fever are the only ones I know about. There may be others, obviously. I'm not a medical expert. But those are the only three which can be transmitted through ordinary sexual activities. But there are others that can be transmitted through other things. For instance, some diseases can be transmitted through the saliva, and one example of that, which everyone has heard of, is rabies. But you can pretty much tell when a dog or some other animal has late-stage rabies due to their behavior and due to, the standard foaming at the mouth and that sort of stuff. So it's relatively easy to keep out of that. It's also pretty rare in developed countries, so it's something to keep an eye on, but it's not exactly something you have to worry about too much. Another one which can be transmitted through saliva is the flea tapeworm, which is, well, it's a tapeworm. It lives in your intestines and eats what you eat. And it's actually not that bad, but basically these things are transmitted through saliva, so if you want to make out with your partner, just be aware that you can get these diseases. It's unlikely. They probably don't have them, and if they're getting proper medical care at a good veterinarian, you should probably be able to catch these early on. But there's no real need to worry that much about them. The rest of these diseases are all basically parasites. Echinococcus, Campylobacter, Cryptosporidium, cystic cirrhosis, Giardia, Salmonella, toxicariasis, all of these are basically transmitted through feces. And, you've heard of dogs getting worms and things. That's basically the most prevalent danger in these sexual activities, and it can really only be transmitted in terms of sexual activity through tongue kissing, and more likely through analingus. It may be exciting, but again, you've got to be careful with that. You've got to make sure that what you're doing is relatively safe. Keep everything clean. Now, with all these diseases, why do I think that zoophilia is in fact less risky than ordinary human sex? Well, because I've looked at the numbers. I've looked at the numbers between how many people are often diagnosed with these zoonoses and how many people are diagnosed with ordinary sexually transmitted diseases. And there's really no contest, at least in terms of the reporting. Now, again, the zoonoses are, of course, underreported because no one's in their right mind is going to admit to sexual activity with an animal. And also, they're probably not even going to think of it as a disease risk anyway. So, even if they might not be hiding something, there's still the possibility that they don't know that's risk. But I would request that anybody who's trying to argue about the disease risks of zoophilia should look at the disease risks of other ordinary human STDs and ask themselves, if these disease risks are higher, and we still think that sex with human beings is permissible, why should we bother with them? I'll tell you some examples of the most recent data. This is from the CDC website, 2011. There were about 100 cases of brucellosis reported in any given year, remember. Compare that to 1.4 million cases of chlamydia, the clade. 457.6 out of 100,000 people carry this disease. Now, it's a relatively minor disease. It's one that can readily be treated, but still, it's annoying. And still we say, even though there are these disease risks of chlamydia, gonorrhea, syphilis, etc., that are so much higher than the reported risks of emerging zoonoses, you have to wonder, well, why is sex with human beings permissible? And really, I think that the answer to this should be obvious, namely, that if you don't want to get diseases, get proper medical care, and also use some form of contraception, a diaphragm or a condom or whatever, and that decreases the risks significantly. Of course, the same measures could be used for animals as well, but with disease risks being not quite so high, there's less reason to do so. Also, an important thing to note is that you can't get the sorts of animals we normally engage with pregnant. You just can't. There's not enough matching in the chromosomes between these two species to actually come up with a viable offspring. I mean, human beings have 46 chromosomes, 23 pairs, and dogs, as an example that I'm most fond of, have 78. There's no way that you're going to be able to, through ordinary sexual intercourse, create anything viable using a combination of those two things. It just doesn't add up. It just doesn't work. Now, there are risks other than disease risks in zoophilia, as there are in ordinary sex. In particular, you need to be careful of the anatomy of a given animal in order to make sure that you're prepared for what they're going to do and can prevent injury for yourself. For example, a dog's penis is not like a human penis. A dog's penis, when a dog is in a sexual act, is going to sort of expand at the base, and it has this gland there that is colloquially called the knot, which what that does is it holds the penis in place while the dog is coming, so that, there's maximal chance of getting a bitch pregnant, of keeping all that sperm inside. Now, this also happens with humans, despite the fact that no real intended pregnancy can happen, so just be aware of that and be careful. With stallions, too, there's a risk, and particularly, one, because of their size in general. They're just huge. And two, their penises have a sort of flare at the end of it that widens when they come. So you do have to be careful of physical injury, especially if you're going for the larger species and you are being penetrated by them. Really big dogs like mastiffs and Irish wolfhounds, or ordinary stallions. With the females, you have to be careful in the other direction. If they're too small, then you might cause injury to them that way. In fact, one news report I saw about a zoophilic encounter somehow had the gall to claim that retina damage was a symptom of zoophilic activity, which is absurd if the activity is being done with creatures of the right size. I mean, basically, the only way you're going to get retinal damage is if you're pounding this thing like a jackhammer. And that's just not going to happen if you're caring and loving toward your partner. So I guess in summary, be prepared for the disease risks and be prepared to minimize them where necessary. Although I don't think that it is very necessary at all. Anyway, I'll make another video later tonight of a more personal nature, but that's it for now. This is the Erudite Canophile signing off.